It was 100 years ago when the influenza virus infected nearly one-third of the world's population. About 50 million deaths were documented worldwide. Although it has been a century, the battle is still ongoing. In an interview with the Associated Press, Dr. Robert Redfield, the director of Centers for Disease Control and Prevention, revealed that an estimated 80,000 Americans died of flu and its complications last winter. Imagine 80,000 lives lost just last year. One of them could have been any of us in this room. One of them could have been any of our loved ones. However, there are a lot of people who refuses to get the flu shot due to some misconceptions about it. Today, with the aid of the information made available by the World Health Organization and CDC, I am going to dispel each of these misconceptions and discuss why the flu vaccine is the best way to protect us from getting the flu. Let's give it a shot. Let's start with the first misconception. The first misconception states that you can get the flu from the flu vaccine. This is wrong. The flu vaccine contains inactivated or killed virus. Therefore, it is no longer infectious. The flu vaccine is made using only a single gene from the flu virus as opposed to the full virus, just so it could generate or produce an immune response without getting infected. The second misconception states that you can still get sick even after getting the flu vaccine. Therefore, it is ineffective. This is also wrong. There are several reasons that a person may get sick even after getting vaccinated. The first reason could be that the person is infected by a different respiratory virus aside from the flu, and that could be associated with flu-like symptoms. The flu vaccine is specifically designed to protect us from just the flu virus. Another reason is that the person may have been exposed to the flu virus shortly before getting vaccinated or during the 2-week period that our body is required to develop the immune response to it. The third reason could be that the person may be exposed to a flu virus that is very different from the viruses that the vaccine is designed to protect us against. This leads me to the third misconception, and I will reinforce this point later on. The third misconception states that you do not need the flu shot if you already had it last year. There are several types of flu viruses, and they are constantly evolving. They change from one season to another, or they could even change within the course of one flu season. The experts annually review and update these flu vaccines as needed to keep up with the changes of these flu viruses. In other words, the flu vaccine must be annually reviewed and updated to match with the flu virus that the experts think will circulate on the coming flu season. In connection with the previous point, the flu virus does not match with the flu vaccine that the person received. Another reason to get the flu vaccine annually is that the vaccine's effects or the body's immune response to it diminishes over time. Therefore, getting the annual flu vaccine is needed to get for optimal protection. So to sum it all up, the influenza vaccine will not give you the flu. It is effective and you need it every year. The World Health Organization and Centers for Disease Control and Prevention, or CDC, states that the flu vaccine is the most effective way to protect ourselves from getting the flu. Its safety is being monitored closely by CDC and FDA, or Food and Drug Authority. However, unfortunately, the flu vaccine is not 100% guaranteed effective, but it is proven that the flu vaccine decreases the severity of illness of those who are infected by the flu after getting vaccinated. A 2017 study showed that the flu vaccine decreased deaths, ICU admissions, and overall hospital stay among those who are hospitalized flu patients. It's just like wearing your seatbelt. You are not guaranteed 100% that you will not crash your car, but wearing your seatbelt will greatly reduce your risk of dying in that car crash. So let me close this speech by asking you this question. Would you rather take that risk, or would you give it a shot?